Recall our terms, right? A solvent plus a solute equals a solution. So a good way to remember this is a thief broke into a building and filled a bag with loot. The police came. The thief hid the loot in a vent so he wouldn't get caught. The solute goes into the solvent. The solute goes into the solvent, and together they make a solution. Recall that in muscles, that every muscle has a belly, an origin, and an insertion. There are tendons connected to muscles, or that kind of form out of or grow out of muscles. Tendons connect muscles to bones. Ligaments connect bones to bones. Every muscle has a belly, a muscle belly. That's where most of the fibers are. Every muscle has an origin. That's where the tendon connects to a bone that is stabilized, or a bone that for the most part is not moving. And it has an insertion, which is a tendinous connection, or a tendon that connects to the muscle of a bone that is to be moved. So for example, in the case of, let's say, like the latissimus dorsi. Latissimus dorsi has connections to the vertebra, the scapula, the ilium, and to the humerus. So let's just look at the humerus and the thoracic vertebra. So the lat, because of its attachment, helps to draw the arm bone down toward the body, and also to internally rotate. It attaches to the inside, so it helps to internally rotate and draw the arm bone down toward the body. And this part here, this part over here, the humerus, the arm bone, is the insertion. It's the bone that's being moved. The bone that is stable is the thoracic spine. You could technically say that the ilium is also stable, but I think it's better to just say the thoracic spine is the one that's stable, because it's closer to the arm bone, and also this upper part that moves the arm is considered the thoracic division of the lat. So everything has an origin. That's a part that for the most part doesn't move or stays stable, and an insertion, that's a part that moves. That moves. Okay, let me just look at the, when we talk about muscles contracting and we think about the bulge of a muscle, the power of the muscle, the part of the muscle that we're talking about are the extrafusal fibers. That makes up most of the muscle cell. But there are also intrafusal fibers, and those are very important. Intrafusal fibers are inside the muscle spindle. Extrafusal fibers are outside the muscle spindle. It's the job of the intrafusal fibers to detect stretch and the rate of stretch. And their job is to protect the muscle from tearing or from being suddenly stretched too quickly. Intrafusal muscle fibers are sensory in nature. So they have nerves which have afferent fibers, or they have nerves or neurons which are afferent. Remember, afferent, letter A, arrives at the central nervous system, arrives in the central nervous system. So the nerve impulses detecting stretch and the rate of stretch go from the muscle through afferent sensory fibers up to the spinal cord or part of the brain. And then the spinal cord, the central nervous system, returns through efferent, letter E, like exiting the central nervous system, through efferent motor fibers, returns an action potential down to the extrafusal fibers of the muscle, and that causes a muscle contraction. So two sets, sensory being afferent and motor being efferent. Also in the muscle structure, in the tendon specifically, are the Golgi tendon organs. The Golgi tendon organs, their job is to detect load. The intrafusal muscle fibers detect stretch. The Golgi tendon organs detect load. So the question is, which does reciprocal inhibition. So reciprocal inhibition means that if the body receives stimulus that a muscle is undergoing some kind of change, either speed or load. I'm not going to tell you which one. You guys have to answer that. If a muscle is undergoing some kind of change that may be unstable or dangerous for it, the central nervous system returns a motor efferent, letter E, impulse to the antagonist in order to inhibit the antagonist and allow the muscle that's being in question to be shortened so that it can contract. So let's say that someone is testing the nerve reflex at the biceps brachii muscle, or better yet, let's say that someone is doing some kind of bicep curl. This is a common way that the bicep tendon is torn, through either a very heavy bicep curl or sometimes through bracing an item, like doing a tire flip in a strongman competition. So let's say that someone is overloading the bicep, and they're about to suddenly let the weight go through the eccentric movement. And the body senses that the stretch and the rate of lengthening in this case, is too fast. What can happen is the body can contract the muscle against the extension, can contract the muscle to stop the fibers from lengthening. And in order to contract the bicep, it has to inhibit the tricep to allow that to happen, right? Because the bicep is the agonist, the tricep is the antagonist. You could explain it many ways. If you tap the biceps tendon in order to elicit to elicit a reflex response, you're in effect lengthening or stretching the biceps, and that tapping will cause a shortening of the biceps, a quick shortening of the biceps muscle. And in order for that biceps muscle to shorten, to contract concentrically, the tricep, the antagonist, has to be inhibited. The tricep has to allow or to relax. So the reciprocal, can you guys unmute now? So the process of reciprocal inhibition stops what? Stretch or load? No. I should ask you first. Reciprocal inhibition is a result of information collected from what structure? From the intrafusal muscle fibers or from the Golgi tendon organs?
Golgi tendon organs.
Unfortunately, it's intrafusal muscle fibers. So Golgi tendon organs, they sense load. So with load, if the load is too heavy, the body needs you to let go. You need to let go and allow lengthening. So that would be agonist inhibition by the Golgi tendon organs. Stretching or shortening, like through a reflex test, or overloading concentrically, overloading eccentrically, has to have antagonist inhibition, reciprocal inhibition. So when you hear reciprocal, think antagonist. The other one is called agonist inhibition, but they're not going to say agonist inhibition and reciprocal inhibition on the test. They're not going to say which one does intrafusal muscle fibers do. Reciprocal inhibition, by the way, there's two, reciprocal and agonist. They're not going to do that. And reciprocal is antagonist. So you have to remember that reciprocal is antagonist, which is the antagonist muscle relaxing or allowing the agonist to shorten. The agonist has to be inhibited, in other words, to lengthen or to let go. When the load of something is too heavy, the load is detected by the Golgi tendon organs. The stretch or the rate of stretch is detected by the intrafusal muscle fibers. So let's why don't you guys repeat after me a few times, right? Reciprocal inhibition.
Reciprocal inhibition
is done with intrafusal muscle fibers.
It's done with intrafusal muscle fibers.
Yeah, for stretch or the rate of stretch.
For stretch or the rate of stretch.
Yeah. Agonist inhibition.
Agonist inhibition
Comes from the Golgi tendon organs.
Comes from Golgi tendon organs
Yeah, as a result of load.
as a result of load.
Yeah. Reciprocal inhibition comes from the intrafusal muscle fibers as a result of stretch. You can do it.
Reciprocal inhibition comes from intrafusal muscle fibers.
We've lost too many people. We've lost too many. No one gets left behind. Okay. Reciprocal inhibition comes from the intrafusal fibers.
Comes from the intrafusal fibers.
Wait a minute. Reciprocal inhibition comes from the intrafusal fibers.
Comes from the intrafusal fibers.
Which detects stretch or the speed of stretch.
Which detects stretch or the speed of stretch.
Yes. Okay. Stretch or the speed of stretch is detected by intrafusal fibers. Okay. Stretch or the speed of stretch. Come on, guys. Stretch or the speed of stretch is detected by the intrafusal fibers. It results in reciprocal inhibition.
It results in reciprocal inhibition.
Good. Force is detected by the Golgi tendon organs, which results in agonist inhibition.
Force is indicated by the Golgi tendon organs.
Good.
That is antagonist inhibition.
Agonist inhibition. Now two of you are not speaking. Okay. Let's do it again. Okay. Force is detected by the Golgi tendon organs.
Forces are detected by Golgi tendon organs.
Nice, which results in agonist inhibition.
Results in agonist inhibition. Sorry, I got cut off for a second. Inhibition.
That's all right. Okay, so the first phrase I said reciprocal inhibition is a result of is a result of the intrafusal muscle fibers detecting stretch. The second time I said stretch is detected by the intrafusal muscle fibers resulting in reciprocal inhibition. Now which one are we going to put first in that phrase?
Reciprocal? No. Agonist.
Intrafusal.
Oh.
Intrafusal. This is a study technique. Okay, let me just write it out for you. Reciprocal inhibition. You know what? You can watch the video. Okay. Intrafusal fibers detect stretch or the rate of stretch. Intrafusal fibers detect stretch or the rate of stretch. Everybody, intrafusal fibers detect stretch or the rate of stretch.
Stretch or the rate of stretch. Intrafusal fiber detect stress or the rate of stretch.
Yes, they can result in antagonist inhibition or reciprocal inhibition.
Antagonist inhibition.
Good. Or reciprocal inhibition.
Or reciprocal inhibition.
Yes, Golgi tendon organs detect load. Tendon organs detect load.
Detects load.
They can result in agonist inhibition.
They can result in
agonist inhibition. Yes. Good. Which does antagonist inhibition? Which one does antagonist inhibition?
The intrafusal.
Yes. Which one does agonist inhibition? Somebody other than Vincent.
Afferent.
Both of those.
I'm sorry.
No, I'm sorry. It's not extrafusal. Extrafusal fibers are the main power source for the muscle, right? They're the ones that do most of the work. The ones that are outside the muscle spindle, they're the motor ones. Which sensory organ does agonist inhibition? The Golgi tendon organs or the intrafusal fibers? Dora. The Golgi. Very good. Which one does now? If you thought I was already mean, which one does agonist activation? Which one causes the agonist to contract?
The Golgi.
Very good. And which one causes the antagonist to activate?
Yeah, that one.
The intrafusal. Yeah. Yes. Okay. Now, does anyone want me to explain activation of the agonist, activation of the antagonist? if it's unclear to you, now would be a good time to go through that. No. Okay. If you change your mind, let me know. We'll do one more thing for the muscles, and then we're going to move on to the lesson for tonight. A whole muscle is made up of many smaller bundles known as fascicles. Each fascicle is made up of many muscle cells or myofibers. Myofibers contain cylindrical bundles of myofibrils, which in turn contain many smaller bundles of myofilaments. So myofilaments make up myofibrils. Myofibrils make up myofibers, which are the muscle cells. And muscle cells make up fascicles, and fascicles make up whole muscles.
Make up fascicles and fascibles.
Make up
Fascibles? How do you pronounce it?
Fascicles.
Okay,
Yeah.
fascicles.
Like popsicle, but fascicle, bicycle, fascicle. Yeah. So if you can remember myofiber is a muscle cell, then you can kind of like draw a line, draw a continuum, and on one side you put fascicle, and on the other side you put everything else, myofibril and myofilament, and that'll be a decent way to organize it. So myofiber as the marker, myofiber is the cell, myofiber is made up of myofibril, myofilament, myofibers make up fascicles and muscle bellies, muscles. Okay, let's give me just a second to move on to tonight's lesson. In the meantime, Stephanie.
Yes.
Stephanie, can you talk to can you teach the rest of the class tonight about concentric and eccentric for like 2-3 minutes? Can you do that?
I don't know. Can I? I think so.
If my grandmother heard you answer a question with a question, you would be in deep trouble. I think you can handle it. Yay, Stephanie. Okay, teach the class about concentric versus eccentric tonight, giving an example of two muscles. For example, the neck flexors and the neck extensors, while I get up the lesson.
Neck flexor, neck extensor. You mean when we flex our neck forward?
I was just using that. I was just using those two muscle groups as an example.
So you want me to use a different muscle group, like the bicep and the tricep?
Any muscle group.
So when you flex your bicep is contracting and your tricep is eccentric. And then when you bend your knee,
you're off to a good start. Yep, keep going.
Your rectus femoris, I think is contracting, and your hamstrings are eccentric. I have my triangle. I'm still learning the muscles, but those are my two examples.
Okay, I think you reversed the hamstrings and the rectus, right?
The rectus, I reverse. Okay, so if I bend my knee, my hamstrings are contracting and my rectus are eccentric.
Yes, and the way you're saying it, contracting and eccentric, is fine because you're saying con and ek. Con meaning with, ek meaning away.
Yes.
But it would be better if you said contracting concentrically, contracting eccentrically. But if you want to just say contract or concentric and just eccentric for the other one, that's fine. That's completely fine. Okay, guys. Did you say that you're still, Stephanie, you said that you're still learning your muscles?
Yeah, well, my small ones, but
the small ones. Okay.
I think I get tripped up with some of the big ones. Just so many.
Dora, Vincent?
Yes.
Are you guys still learning your muscles?
A little bit,
Yeah.
yes.
I am too,
Okay.
especially the smaller ones.
Okay.
Yeah.
Okay. So, okay. Well, there's a lot of stuff that we have to cover, and you know, we definitely should be covering the muscles. Let's do a little bit of the heart. I'm going to show you guys. This is a thing we have to cover. I'm going to show you guys what you have to study in the order and how to study it. I'm not going to drill you on it. All right. So I'm going to try to leave a little time. That I'm just trying not to spend all the time on that. Okay. So we see here 3 drawings of the heart. Here's the one in red and blue. Here's the one with the lungs on either side. And here's the one with the valves showing very clearly. The valves and the arteries and veins, the vasculature showing very clearly. The structures that you're going to need to know for the exam are the veins and the arteries which supply or take blood away from the heart and supply other organs like the lungs or the rest of the body, the top and the bottom of the body. And the way that you can study them, called the order of blood flow, is right here. So when blood first comes into, starting with blood coming into the heart, when it first comes into the heart, it comes in through the right side. They're going to ask you to know that. It's going to come in through the right side, through the SVC, IVC. That's the superior vena cava. You see there's an SVC up here, that's superior, and there's an IVC down here, that's inferior. Inferior vena cava, superior vena cava. Those come in through, those come in to the right atrium, and they pass from the right atrium into the right ventricle through the tricuspid valve. So it's superior inferior vena cava, right atrium, tricuspid valve, right ventricle. And then from the right ventricle, it goes through the pulmonary valve into the pulmonary artery. So through the pulmonary valve into the pulmonary artery. Guess where the pulmonary artery terminates or leads? To the pulma, which are the lungs. The lungs. So superior inferior vena cava, right atrium, letter A, shaped like this. Atrium, like the atrium of a building, is the ceiling more or less. Goes on top. It's the roof. Goes on top. A goes on top. A ventricle shaped like a V, that ventricle receives. It's on the bottom. A is on top, atrium. Ventricle, V is on the bottom. It's the it's the tricuspid valve which separates them on the right. Tricuspid on the right. Mitral or bicuspid on the left. You're just going to have to commit that to memory. Tricuspid on the right, the other one on the left, bicuspid or mitral valve. Mitral, by the way, I believe refers to the shape of the valve. Looks kind of like a religious skull cap that is worn in Islam. Don't quote me on that, but I believe that's what mitral refers to, that kind of shape. So the blood goes out the pulmonary artery. Arteries go away from the heart. Veins come toward the heart. Arteries go away. Blood goes towards the lungs, and it goes in through the pulmonary arteries, and then it goes into the lungs, and the blood is exchanged from the arteries to the veins, and the veins bring it back to the heart. The pulmonary veins bring the blood. There's a clearer picture down here. The pulmonary veins bring the blood back into the left atrium. It goes through the bicuspid valve into the left ventricle, and then it goes up into the aorta. Make sure I'm telling you correctly. Through the pulmonary veins, into the left atrium, through the mitral valve into the left ventricle. Atrium, mitral valve, bicuspid valve, left ventricle, through the aortic valve into the aorta. These big veins and arteries, like the pulmonary artery, the aorta, their valves are easy to remember because they're named after the vessel they're going to, or that they end up going through. So the blood that goes from the aorta, the blood that goes from the left ventricle into the aorta goes through the aortic valve. The blood that goes from the right ventricle into the pulmonary artery goes through the pulmonary valve. Pulmonary artery, pulmonary valve. Aorta, aortic valve. The job of the aorta is to take oxygenated blood both up through ascending, you won't really have to know that, up to the upper body, and down through the descending aorta. And then it returns to the heart through the inferior vena cava and the superior vena cava. So if you guys want to get your heart knowledge together, really all you have to do is memorize the order of the blood flow. Recall that the FSMTB was specific, that you do not need to know the structures that supply blood to the heart muscle. I need to go close the door to the room. Hold on a second. I'm sorry. Everything in New York City is small and cramped together except for the price tag. Hey, here's a tiny apartment. It's $3,000, sucker. Okay, so the arteries and veins that supply the heart muscle, that nourish, oxygenate the heart muscle, those you don't have to know. Coronary artery, marginal artery, descending artery, circumflex artery. You don't have to know those. These are the ones through which a lot of myocardial infarction happens, a lot of heart attack happens, because these are the ones which get blocked through things like plaque or maybe through thrombuses, and they starve the oxygenated blood. They starve the heart muscle of oxygenated blood. So you don't have to know those. It's the order of blood flow here. Okay, now I don't usually do it this way, but I'm willing to just move on from the heart. Can I get some feedback from you guys? Do you think that you can be responsible for this information to work on it yourself? Is it okay for us to move on?
Yes.
Yes. Yes. Yes.
Yeah. Okay. Great. Awesome. So let's take a look at some of the muscles in the body, and then we're going to look at some. We're going to do some some other stuff, like we'll do some legal or some ethics or stuff like that, because we have to get into those things. Okay. So this muscle here is the SCM. The SCM stands for the sternocleidomastoid. So there's three structures, sterno, cleido, and mastoid, and there's three students. So Vincent,
Yes.
where's the sterno part of the sternocleidomastoid? Where does it attach?
From the bottom of your ear all the way down to your
Yes, I want to know where the sterno part or the sternal fibers attach.
I guess it'd be all the way to your shoulder. Well, not through your shoulder, but I don't know. It's past the triangle you were talking about the other night.
Yes, Vincent, you are definitely paying attention, and I can see that all that information is swirling around, but not quite organized, right? When you organize, when you clean things up, you can get them really sharp. Okay, so you guys, let's touch the different structures. So this is the sternum. These are the sternal fibers. Sternocleidomastoid. Sternum, sternocleidomastoid, right?
Sternum.
Yeah, this is the clavicle. Cleido, sternocleidomastoid, right? And this is the mastoid process. This is the mastoid process. Down here, you were saying under your ear, Vincent. This is mastoid. So this is the sternocleidomastoid process, right? That's the mastoid process where the sternocleidomastoid muscle attaches. So it's the mastoid. You guys, let's go through this 3 times. Mastoid, sternum, and then clavicle or cleido. Mastoid, sternum, and then clavicle or cleido. Let's go the other way. Clavicle or cleido, sternum, and then mastoid, sternocleidomastoid muscle. SCM, the sternocleidomastoid. Let me get you a different drawing of the muscles of the neck. So the sternocleidomastoid is a good marker to divide the neck into the different triangles, and in the triangles you find, oh, this is the same drawing. No wonder I picked this thing out, because I'm like, hey, that looks like a good one. Do this one first. And if you look at the front triangle or the front of the neck, you find a lot of muscles. You guys don't, I don't think that you have to know these small muscles like the digastric muscle, the mylohyoid muscle. However, if you've seen them and you know that they're in the anterior triangle, at least you'll be ahead of the game, right? If you know that they're like around the jaw or somewhere in the upper part of the neck, you'll at least have somewhat of a clue. So the digastric and the mylohyoid are here. The stylohyoid, and there's another digastric muscle here. Oh, no, this is the same digastric muscle. The digastric muscle is bound by a tendon that attaches to the hyoid bone. The tendon is like I forget what it's called, some kind of aponeurosis or something that grabs part of the muscle and forms kind of like a right angle there. And then you have the styloid muscle here, the hyoid bone, which is one of the few floating bones in the body. It's not attached to any other bones. There's actually a thyrohyoid muscle. There's an omohyoid muscle, a sternohyoid muscle, right? And then bordering them all is the sternocleidomastoid. Remember, it's the sternum, it's the clavicle for cleido, and then it's the mastoid process for sternocleidomastoid. You guys all know the bones of the so-called breastbone, which the top one is called the manubrium. Hopefully you guys are familiar with this. You can feel these on your own body. There's like a trapezoid shaped bone at the top with a very small line about this far, I guess about 1.5 inches, 2 inches down, where the manubrium attaches to the sternum. And these are joints that are meant not to move, to be the most stable joints in the body. They are fibrous joints. They're also called syndesmotic or synarthrotic or synarthrosis joints. Synarthrosis. Arthur meaning joint, syn meaning synthesis or joining, two becoming one. So the manubrium joining to the sternum, and then the sternum joining to the xiphoid process down here. Other synarthrotic joints in the area are the ribs joining to the sternum. Then you have the clavicle, which articulates with the manubrium or with the sternum. Sometimes manubrium and sternum are sometimes used interchangeably, where attachments and articulations of bones. Articulation is like where two bones join each other. So this distal phalange and this proximal phalange, they articulate right here. And below the clavicle, just below the clavicle and all along the sternum, we see the pectoralis major muscle. We'll go over the other pecs and the subclavius muscle in a moment. This big muscle that you see on top, that's the trap. That's the one that shrugs the shoulder. And over here is the deltoid muscle. So let's take a look at if we look at the muscles of the back and the neck, what we see are that there are layers, right? There's a shallow, a medium, and deep layers. So let's take a look at. Yeah, good. Okay, so here we have just the cervical region, right? Here's the occiput. Here's the mastoid bone over here, right? And then coming off of the mastoid bone is the sternocleidomastoid muscle, right? Here's the occiput. Coming off of the occiput is the upper trapezius, fibers of the upper trapezius. Don't forget the trap has 3 sections. It's got the upper trapezius that moves the shoulder. It has the middle trapezius, which moves the scapula, and it has the lower fibers, which also move the scapula. So the shallow layer is made up of the trapezius muscle in the neck, and then the middle layer is made up of these other muscles, and you should know these. I've seen test prep questions ask about the capitis muscles. So cap, like a cap that you put on your head, is a muscle that attaches to the occiput, or a muscle that attaches to the skull, to the head. So they are called the semispinalis capitis muscle and the splenius capitis muscle. Now, I don't think that they're going to ask you, which one does the function of side bending and which one does the function of extension. Is it the semispinalis or the splenius capitis? I don't think that they'll ask you like that. I think what they'll ask you is more like, which ones make up the middle layer of the muscle, not the deep layer or the shallow layer, right? Not the deeper superficial, but the middle layer. So you need to remember that it's the capitis muscles. And then the cervicis muscles, attach to the cervical spine. So if we look at where are the cervicis muscles here, they don't have it. Okay, that's a little bit too abstract, that one. I'm sorry. Maybe this one, yeah. Okay, so what we have here are the semispinalis capitis. Capitis attaches to the skull. Semispinalis capitis. Missing is the other capitis muscle, but this is the middle layer of the neck on the left, and then on the right you have the deep layer of the neck. These muscles here are the multifidi, and then you have these small muscles here, which, like the oblique capitis superior, oblique capitis inferior. I don't think they're going to ask you about that. The rectus capitis posterior major, rectus capitis posterior minor. I don't think they're going to ask you about those. But if it says that it's a capitis muscle, and there are 3 of them, it's the deltoid muscles at the occiput. I seriously doubt that they're going to ask you that. But remember, capitis muscle attaches to the cap, to the skull, and they're part of the middle layer. The deep layer are the multifidi and the rotatores. Where are the rotatores? The rotatores I don't think are visible here. I'll show you the rotatores in a moment. While we're here, also the levator scapula is an important muscle that attaches to the neck. It goes from this corner of the scapula, which you do need to know. This is the superior angle of the scapula. This is the inferior angle of the scapula. You may see it written as the superior and medial border of the scapula as compared to the superior and lateral border of the scapula, but this is almost always called the angle. The inferior one is almost always called the angle. Let's finish up with the muscle layers of the back, and then we'll look at the shoulder and the hip, and then we'll move on to something else. So let's see if I can get a clear. So SEG stands for spinal erector group. No, we're not looking for, okay. So let's look at like a superficial middle and deep muscles of the back. Yeah. Okay. Let's see how this is organized. Superficial muscles which attach to the shoulder girdle. They don't all attach to the shoulder girdle. So they're obviously not talking about what I'm talking about. Okay, so they put the capitis and the cervices as the superficial group, the intermedius as the iliocostalis, which is not in the neck, longissimus and spinalis, which are in the thoracic and the lumbar, and the deep group, which is semispinalis, multifidus, rotatories. So I have seen questions asking about the different depth of the muscle groups, and this is something that I do think you should know. So let's take a look. Just a minute. I'm getting oriented to how this page is laid out. I see. Okay, so they don't have the rhomboids listed. Okay, I see. They're probably just not listing the rhomboids specifically because they're looking at the ones right next to the spine. So they're listing the splenius capitis and the splenius cervicis muscles as superficial. That's fine. So regard those as superficial along with the trapezius muscle. Splenius capitis and splenius cervicis as superficial along with the trapezius muscle. And then in the middle layer, you have the iliocostalis, which includes 3 sections, the one in the low back, the one in the thoracic spine, and the one in the neck, the iliocostalis lumborum, thoracis, and cervicis. Okay, here's like a clever thing to remember from lateral to medial. So the most medial is the spinalis group. A useful mnemonic for these 3 muscles from lateral to medial is I love sex, ILS for iliocostalis, and then longissimus, and then spinalis. So it's the iliocostalis, then the longissimus, and the spinalis, semispinalis muscle. And those muscles are part of the middle. I love sex. Semispinalis. This is from Gray's Anatomy. This is like the oldest anatomy that we have on file. And I think that might be like not so useful. The longissimus. And then the spinalis muscles, spinalis capitis, cervicis, and thoracis. Spinalis capitis, longissimus cervicis. I'm not seeing the, yeah. So the summary is the 2 groups we just covered are the splenius capitis and splenius cervicis. So that's splenius capitis, splenius cervicis. And then the intermediate is I love sex, which is iliocostalis, longissimus, and then spinalis. And they all have cervicis, thoracis. Some of them have lumborum. Okay, and then the deep group we haven't looked at: semispinalis, multifidus, rotatories. What are these? I have not seen. I'm not familiar with these muscles and haven't seen them asked on the test. So yeah, so I'm going to skip those tonight. So the semispinalis, capitis, and cervicis are the deepest muscles next to the neck. Semispinalis, capitis, and cervicis. Yeah, semispinalis capitis and semispinalis cervicis. Semispinalis capitis, semispinalis cervicis. Then the multifidus. The multifidus are pretty important for you to know their movements. So mainly Proprioception for the vertebral column, but they do function in rotation, extension, and lateral flexion. So do those movements as we're saying them. So rotation is rotating through the spine, extension is extending the spine, and then lateral flexion is bending to one side. This is the multifidus muscle. And it looks like this. So look at the fibers of the multifidus. So you can imagine the direction that the fibers are going. This is the let's see, transverse process versus spinous process. This is the transverse process of one vertebra going to, I think, the spinous process of the vertebra above it. So the side of one vertebra to the back of one vertebra above it. So you can imagine that it would pull this way. It would pull the vertebral column in a left curve. So side bending to the left. So the left multifidus contracts to the left side in this case. And also there's some extension and some rotation. And then the rotatories. The rotatories function to rotate the spine. Here's the rotatories right here. The rotatories longi and rotatories brevis. So again, it's from the transverse process of one to the spinous process of the other. You guys remember that the transverse process, commit to memory that the transverse process goes transverse. It's the bony protrusions on the sides of the vertebrae, left and right transverse. And then the spinous process is the one that feels like the spine when you touch it. So it's on the back. Spinous process on the back of the spine, transverse process on the sides of the spine. Okay, multifidi and rotatories we just covered. Yeah. Interspinalis, intertransversari, and levators costarum. I'm not familiar with these muscles, so I'm not going to spend any time on them. As a matter of fact, it looks like they're not even giving them a diagram. Okay, so the deep muscles, the rotatories and the multifidi and the semispinalis. Rotatories, okay, multifidus, semispinalis, and multifidi. Rotatories, semispinalis, and multifidi. And then the middle is the I love sex. Sex is spinalis. Love is longissimus cervicis. Which one is that? Longissimus cervicis. Capitis and thoracis, right? It has three parts: cervicis, capitis, and thoracis. So it's like you know, less to remember. You just have to remember longissimus. Longissimus goes from the cervicis through the thoracis and up to the head, the capitis. And then the I is the iliocostalis. Iliocostalis. Where's your iliocostalis drawing? There you go, the iliocostalis. Iliocostalis. That's the intermediate or the middle layer. Let's look at these. Let's see if we can find like a summary image. Yeah, like this. Actually, let's look at this one because it's a little bit less. No, what they're showing is they're showing the serratus muscles, and the middle layer, the iliocostalis muscles and all those, they just happen to be there. Sometimes they show these muscles with like the shallow layer on one side and the deep layer on the other side. This looks like a little bit more, yeah, this is a little bit more simplified. KenHub is a pretty good site. The deep back muscles and then the intermediate muscles. Click to make the most out of this idea with a free account, and not right now. All right, so on one side we have the iliocostalis, the longissimus, and the spinalis. That's I love sex. What is that? The middle or the deep? Is that the intermediate or the deep?
The intermediate.
That's the intermediate. That's right. Iliocostalis, longissimus, and spinalis. That's the ESG, erector spinae muscle, or erector spinae group, ESGs. Okay, and then on the other side, you have the spinalis thoracis, spinalis cervicis, right? So you have spinalis cervicis, and then spinalis thoracis. And then next to that, you have the longissimus, Guess why it's called the longissimus? Because it's a long one. Longissimus, and then there's the longissimus cervicis, longissimus thoracis, longissimus cervicis. But all you have to remember is spinalis, and then longissimus, and then iliocostalis. Not iliocostalis, I'm sorry, iliocostalis is the intermediate group. Longissimus and spinalis. Also are the deep muscles. And if we look at the deep muscles, oh, these aren't labeled. Okay, so here we have the multifidi. We have the multifidi muscles. The rotatories are deep to the multifidi, but they are part of the deep muscle group. And then you have the iliocostalis lumborum, which is above that, or the iliocostalis, part of the I love sex. So you have the multifidi, the rotatories in the deep layer, and the semispinalis muscles. Semispinalis muscles, which look like, oh, here's beautiful multifidus. I like Ken Hub. And beautiful rotatories. And beautiful semispinalis. Okay, if you look at the, here they show the rotatories, and they show the semispinalis muscles. So these long ones are the semispinalis cervicis. Cervicis refers to cervical. And yeah, semispinalis cervicis. And these are the, I don't want to get that wrong. These are the rotatories. So if you look at the structure and the direction of the rotatories, and the structure and the direction of the semispinalis, interspinalis, semispinalis, you see these are the semispinalis muscles. They're basically the same direction, right? They're diagonal. And also the multifidi are also diagonals. Let me get that a little more clear for you. The multifidi are also diagonals. I can barely tell the difference between a multifidus muscle and a rotatories muscle, except that, or a semispinalis muscle, except that I know that the multifidus fibers are more dense and the rotatories are more separated, right? The multifidus is really dense packed, and then the rotatories are more separated. You see there's space between them. Right? Okay, so now this I will drill you on. Okay, so let me stop sharing my screen so that I can really be mean to you guys. Stop share. All right. Okay, so which muscles make up the, let's start with the easy one, okay? Which muscles make up the intermediate layer? Feel free to say, I love sex.
I love sex.
Yeah, what I meant was quietly. Okay, now try to say the actual muscle names. The I stands for what? Yeah, it is fine. It is fine, and Icola is fine. It's iliocostalis. That's fine. Yeah. Love, what's the L stand for? Letter L is the long one.
Yeah.
Longissus.
Longissus.
Longissus or longissimus. Yeah. Longissus or longissimus. Dora and Stephanie, I hope you guys are speaking along with us, and feel free to speak up. Okay, and then and then sex. What's sex stand for? What's the S stand for? Spinalis.
Oh, spinalis.
Spinalis, right. And remember that some of these have three sections. So there may be like a iliocostalis cervicis, an iliocostalis thoracis, an iliocostalis lumborum, or there may be like spinalis capitis, spinalis cervicis, spinalis thoracis, right? But I seriously doubt they're going to ask you about all three sections of each group. They'll ask you about the intercostalis longissimus spinalis as being, what layer of the body. Okay, so intermediate, again, I love sex. The I is for?
Sure. No.
Egalis.
Not egalis, ilium. Your ilium is your hip. So it goes from your hip, and costalis is the cartilage. So from your hip up to the
Iliocostalis.
costa, which is part of the ribs, not cartilage, but costa is part of the ribs. So from the ilium up to the ribs, iliocostalis. And then the long one, love, longissimus, and then sex, letter S, spinalis. Yes. Okay, and then the deep layer, remember, those are the small ones, name one of the small ones whose muscle fibers go predominantly in a similar direction, like a diagonal direction. The deep layers go diagonally.
The multifidus?
Multifidus. If you can remember multifidus, you can remember the one that looks similar to it, hopefully, which is?
We were just talking about it, I forgot.
Rotatoris. That's right, the rotatoris, yeah. And there's another one which is a little tricky, which is semispinalis. Yes. Semispinalis, yes. Semispinalis, multifidus, and rotatories. Semispinalis, multifidus, and rotatories. Come on with me. Semispinalis, multifidus, rotatories. Semispinalis, multifidus, rotatories. Good. Okay, and then the superficial layer. The superficial layer has the splenius muscles. So splenius capitis, splenius cervicis, the splenius muscles. The splenius muscles are the superficial layer. The spinalis muscles are the intermediate. The semispinalis are the deep. Semispinalis are the deep. So it's splenius, spinalis, semispinalis, from superficial, intermediate to deep. Try that. Splenius.
Spinalis.
Spinalis, semispinalis. Again, splenius, spinalis, semispinalis. Yes. Okay, and rounding out the superficial layer, the additional muscles of the superficial layer of the back, the splenius muscles, and then is that all that's in there? Oh yeah, that's all that's in there. Oh, thank God. It's the splenius muscles, splenius capitis, splenius cervicis. Okay, let me bring back the screen share, and then I had an idea on how to study this, which is to write it out. So either get out something you can write on, like pencil, pen, paper, or you guys get out, get something on your computer that you can write on. So this is the ANP1 suggestions, study suggestions. I'll just put this like study guide, all right? And the reason I call it suggestions or guide is because there's so much in anatomy and physiology, it's like impossible to remember it all. Okay, so we're looking at the muscle layers of the neck and back. So you have the superficial, intermediate, and deep. So remember, the intermediate is our funny acronym. Which one is that?
I love sex.
I love sex. Every human being is saying that, and most animals are saying that. So the I is for ilio, from the ilium up to the ribs, iliocostalis, costalis. Iliocostalis. The L is the long one. That's the longissimus. So you guys write these with me. And the S, what's the S stand for again?
Spinalis.
Spinalis, yeah. And remember, it's semispinalis in the deep. So let's do the deep next. So with the deep, remember, those are the ones that are diagonal shaped.
Yeah. Multifidal.
Yeah, multifidal is fine. It's multifidus. Mm-hmm. Rotatores. And then there's one more, which is the
intercostals.
I don't think so. There's the semispinalis. Semispinalis. Okay, let me double check. I may have reversed spinalis and semispinalis. You know, this is the kind of thing that you have to I have to review all the time. Semispinalis. Yeah, it's the semispinalis. And then it's this let me finish here. Okay, it's the multifidus, rotatores, and the semispinalis in the deep diagonal shaped muscles in the deep layer. And then in the superficial layer, it's the splenius muscles. Now I want you guys to add that there's I'll do it in a different section, okay? But these are the muscle layers of the back. All right. So you guys take a break. Take a 10-minute break. I'm going to get some of these notes together a little bit more, and then I wanted to do the shoulder and the hip muscles, but I think we should move on to some other stuff, and we'll do the shoulder and hip muscles next time. But I really, really, really want you guys to look at the muscles of the shoulder and the muscles of the hip on your own. Don't be concerned with like what order or what grouping to study them in. Just start with the medial portion. Just start with the medial portion of the structure and go through around the front to the side, to the back, and then the fourth part, which is the inside, the most medial, or the I don't even know what this surface is called, but there are muscles on the inside, like for the shoulder, it's the subscapularis, and then for the hip and leg, it's the adductor muscles, right? So you got to look at those ones on the inside too. So the front, the side, the back, and the inside. Just start going through them. Okay, take a break. Come back at 9:31. 9:31. To go through to learn this material for ethics, laws, boundaries, regs, etc. I think it's completely fine to learn it by doing questions. And that's one nice thing about it, is that we don't have to do like so much foundational material and then do questions on top of it, because we can learn the foundations through the questions. All right, so you guys just unmute and call out, all right? Can everybody see this? Is this large enough?
Yes.
Yeah.
Okay, just call out if you can't see it. Say, I can't see it. What does the word abuse mean? A professional relationship in which a more experienced practitioner shares information, skills, and insights with a less experienced practitioner to provide encouragement and support. The improper use, handling, or treatment, often to unfairly or improperly gain benefit, to withdraw support, especially in spite of duty, allegiance, or responsibility. An obligation or willingness to accept responsibility to account for one's actions and consequences. What does the word abuse mean?
B.
All except A.
Yeah, say B.
Okay, so 2 A's, 2 B's, and 1 A. So let's reread it. So A is a professional relationship in which a more experienced practitioner shares information, skills, and insights with a less experienced practitioner to provide encouragement and support. Does that sound like abuse?
No.
That sounds like, I'd call that mentorship. The improper use, handling, or treatment, often to unfairly or improperly gain benefit. Yeah, definitely. Definitely B. B, the improper use, yes. Abuse is the improper use, handling, or treatment often to unfairly or improperly gain benefit. Mentoring is the professional relationship in which a more experienced practitioner shares with a less experienced practitioner. Withdrawing support, especially in spite of duty or allegiance, is called abandonment. That's a legal term. Accountability is an obligation or a willingness to accept responsibility or to account for one's actions. An obligation or willingness to accept responsibility or account for one's actions and consequences. That's accountability.
There's more than one answer, correct?
There's only one answer. There's only one answer. Tell me why you think there's more than one answer.
Because I thought all of them except A might have been the answer.
You thought B, C, and D may also be the answer.
Mm-hmm.
Okay, so abuse means improper use, to use something that you're not supposed to use for benefit, right? To use something for your benefit, to gain benefit that you're not supposed to use for a benefit. So, like abuse can be sexual. That's what we usually think of, where you use your influence or power or maybe your physical position over someone else in order to gain sexual benefit. Abuse can be financial, where perhaps you abuse the billing system, the insurance billing system, in order to gain that kind of benefit. And there are, I'm sure, like other kinds of abuse, but those are the two that I think of right away. Okay. Improper use, handling of someone's health insurance, handling of someone's trust in you improperly to gain benefit, right? Handling of the treatment improperly to gain your own benefit. And then to withdraw support, to withhold support. Yeah, you can be abusive withdrawing or withholding support. But when you withdraw, that word withdraw, it's especially abandonment. So if you say to a client, I'm not going to treat you anymore in the state of New York, without providing them with a referral, the recommendation to go back to their primary care physician to find another therapist, or without referring them to at least 2 other acupuncturists, that is legal abandonment, because you are withdrawing support without providing a replacement for the support, making sure someone doesn't get support. And then an obligation or willingness to accept responsibility. That's asking you, Stephanie, I want you to accept responsibility for your actions or to account for your actions, whether they're positive or whether they're negative and have consequences. I want you to accept responsibility. That's your accountability. That's accountability. Okay. A code of conduct that provides guidelines to those who post content on the internet, either as part of a business or as a private individual, either as part of a business or a private individual like solo practitioner. Code of conduct that provides guidelines to those who post content on the internet. Standards of practice, competency, code of ethics, or social media policy.
Social media policy.
Yes, a code of conduct that provides guidelines to those who post content on the internet. Social media policy. What is the meaning of the term scope of practice? In some states, it is used as the designation for practitioners rather than licensure, a process in which a person, an institution, or a program is evaluated and recognized as meeting certain predeterminable standards to provide safe and ethical care. Used as a designation for practitioners rather than licensure. Most commonly defined by state law, this outlines the care you are able to provide for a patient or client, the where, when, and how a practitioner may provide services or functions as a professional. Most commonly defined by state law outlines the care you're able to provide for the patient or client. A set of rules designed to address applicable state and federal laws, as well as established business practices and professional ethical standards. A set of rules designed to address applicable state and federal laws, as well as established business and professional ethical standards. A statement of intent that defines expectations and is implemented as a procedure or protocol. So what do you guys think?
B.
Letter B, that's right. It outlines the care you're able to provide. This next one, a set of rules designed to address applicable state and federal laws. That is a code of conduct, a code of conduct. They're going to ask you about, they may ask you about these others. A code of conduct, a set of rules designed to address applicable state and federal laws, code of conduct. Scope of practice is the care you are able to provide, the care you're licensed or certified to provide. What is within your scope, right? And then this one, designation for practitioners other than licensure is a certification. So a certified acupuncturist is a thing in New York. A licensed acupuncturist is a thing in New York. I don't know if you guys have certified massage therapists compared to licensed massage therapist. Probably is in some states. And then in Connecticut, yeah. And then policy is a statement of intent that defines expectations, what the client can expect, and what you expect. You expect your client to give 24 hours notice, to pay at the time of the visit, you know, things like that, right? As a procedure or a protocol. Policy. The experience of, I guess we're just going to show the answer right away. The experience of reliving or re-experiencing a traumatic event as if it is occurring or is imminent is known as a trigger, complex post-traumatic stress disorder, flashback, or hyperarousal. The answer is flashback. Does a flashback, guys, does a flashback happen before or after a trigger? No, which happens first, the flashback or the trigger?
The trigger.
That's right. Is the state that you're in, that person is in, a state of hyperarousal, or is it a state of post-traumatic stress disorder?
Post-traumatic stress.
The state is hyperarousal. The state is hyperarousal. Their nervous system is hyper alert, hyper aroused. The diagnosis is post-traumatic stress disorder or complex post-traumatic stress disorder. This is what they suffer from. This is how they function. Hyperarousal is how they function. Of the following, which is the best choice for a scope of practice? What is this question doing here in ethics, laws, boundaries, and regs? Anyway, of the following, which is the best choice for a scope of practice defined as a service provided to enhance the health, condition, and appearance of skin, hair, and nails? Skin, hair, and nails. Cosmetology, osteopathic medicine, naturopathy, pediatric medicine.
Cosmetology.
Cosmetology. Everybody agree?
Yes.
Yes, cosmetology. A blank, also referred to as a multiple relationship, occurs between a therapist and a client when additional relationship roles such as friend or business associate exist. What is this called? Professional relationship, dual relationship, homeostatic relationship, or a personal relationship?
Dual relationship.
Yes, that's right. Why is it a dual relationship, Victor? Vincent, I'm sorry.
It's because you're being a massage therapist and also a business associate or a friend.
Yes, that's right. You're being two things at the same time. Okay. Blank is a code of behavior that delineates expectations. Behaviors that fall under the heading of good manners include cancellation notification, being punctual, hygiene, and personal habits. Blank is a code of behavior that delineates expectations. We just learned about that. So is that competency, etiquette, work ethic, or social media policy? Oh, it's a different type, different phrase here.
B? A.
It is B.
Oh, it is B. Okay.
Yes. And what tips you off is the second sentence, behaviors that fall under the heading of good manners. Rarely is anything wasted in these questions. If they give you two sentences, you got to read both sentences. There's something in the second sentence that's important. All right. Yeah. What is the meaning of the term clinical supervision? Is that a process of meeting regularly with a person who is trained in the skills of supervision to discuss casework and other professional issues in a structured way? Is it a protective circle around the professional relationship that separates what is appropriate between practitioner and client from what is not appropriate? Is it a group or individual process that helps participants seek and reach goals? Usually there is one leader directing the activities and guiding the persons in finding their own inner strength to follow through on their dreams. Is it a group of colleagues who meet regularly to discuss common issues related to their professional lives, to share information and strategies, and to receive emotional support? Which one?
B or D?
Okay, so B is a protective circle around the professional relationship that separates what's appropriate and not appropriate between the practitioner and client. What does that sound like to you? What term? A protective circle.
I'm gonna say C.
Yep. Vincent, what would you?
Yes.
What term would you use for a protective circle around the professional relationship?
Mentor. My fault.
No, boundary.
Oh, boundary. My fault.
Boundary, a protective boundary. Okay, and then a group or individual process that helps participants set and reach goals. That's like a I don't want to tell you wrong, but it's something like a business mentorship. And then a group of colleagues who meet regularly to discuss common issues related to professional lives, share information and strategies. I'm not sure what, and receive emotional support. Not sure what that is. A process meeting regularly with a person who's trained in the skills of supervision to discuss casework and other professional issues in a structured way is clinical supervision. This group of colleagues who meet for emotional support, that's a peer group. An individual or a process that helps participants reach goals and follow through on their dreams, that's coaching. Mentorship happens through coaching. Coaching happens through mentorship. Blank is a transgression that may or may not be experienced as harmful. Boundary crossing, a boundary, transgression, or autonomy. Which one?
Boundary.
Okay, is boundary a transgression? Or is boundary a protective circle that prevents transgressions?
So transgression?
Boundary is a protective circle that prevents transgressions. Boundary crossing, yes. What is the difference between boundary crossing and transgression?
Transgression sounds more harmful or something.
Yes, that's exactly right. That's exactly right. And now read the question for me, please.
It says transition that may or may not as harmful.
That's right. Yes. So you see why it cannot be transgression.
Yes.
Yes. And autonomy, what's autonomy mean? Anyone? Auto means self. So what does autonomy mean? If you're autonomous, you do things for yourself. You get to decide and act for yourself. It's your free will, your right to decide for yourself. When a therapist honestly represents all professional qualifications and affiliations, they provide appropriate, okay, first of all, professional qualification, that's like your license and where you went to school. That's your qualifications. An affiliation is maybe you belong to a professional group, like maybe you're a member of, I don't know, the American Massage Therapy Association. That's something you have to join, right? Are you providing appropriate credentials by openly displaying certifications and licensing? Are you creating trust so the client has no doubt? Are you assuring clients by displaying your knowledge and using medical terms they may not understand? Should avoid the question asked by diverting attention to another matter. So these last two are like toss outs.
A.
So it's A.
Yeah, it's A. Yeah. Yeah, okay. Okay, moving on. What is the meaning of the word? I'm just going to skip this, okay? Sensuality is the quality or state of being sensual. What is the meaning of the word mentoring? An obligation or willingness to accept responsibility to account for one's actions and consequences. What's that term defined as, Stephanie?
An obligation or willingness to accept responsibility.
I want you to be what for your actions and the consequences?
Accountable?
Yes. Mentoring, a professional relationship in which a more experienced practitioner shares information, skills, and insights with less experienced practitioners to provide encouragement and support. To withdraw support, especially in spite of duty, the improper use, handling, or treatment.
B.
B, yes, very good. What is the meaning of the term? What is the meaning of the term body language? That is communication in which people reveal clues to unspoken intentions or feelings through physical behaviors such as posture, gestures, facial expressions, and eye movements. The reason I'm just like quickly going through questions like body language and sensuality is because I think that they're too obvious to dissect, and it's 9:52. If you guys don't feel that way, if you want to go through them and get into the nitty gritty, you just let me know. What is the meaning of the word intimacy? A close association with or detailed knowledge of or deep understanding of a person. What is the meaning of the word hyperarousal? A physiological and psychological state of being awake, reactive to stimuli, or ready for activity. It involves the brainstem, the autonomic nervous system, and the endocrine system.
Yeah.
A state, yes, it's very possible, but being awake, reactive to stimuli, ready for activity, does that sound automatically like hyper arousal? Or does it just sound like, alertness or arousal?
Well, then it's B.
A state of constant alertness to danger, constant alertness, experienced by survivors of trauma, also described as chronic state of fight or flight. Yeah. A what is a focused group setting where the individuals in the group create specific goals for their business or career and provide each other with support and inspiration for achieving those goals. Is that a mastermind group, peer group, mentorship, or online discussion forum?
Peer group.
Peer group.
Peer group is for emotional support. They share stories. Yeah. Mastermind group, I think. Yeah. Not a mentor. A mentor is one person who shares information with another person. Usually it's from older, more experienced to younger, less experienced. What is the meaning of the term insider trading? That is financial gains that the individual may make based on information about company stock not available to the public. A blank is a systemic method or approach to gathering information about a client's condition and symptoms. Systematic method, like an organized method or approach to gathering information about a client's condition. Assessment, yes, assessment. Psychological strategies of relating to the world that are developed unconsciously to protect people from shame, anxiety, or other emotionally painful experiences that they are unable to handle otherwise is known as burnout, defense mechanisms, mediation, or sublimation.
Defense mechanism?
Yes. What is the meaning of the word sexualization? It is to make an event, a procedure, a conversation, or an experience into something that is sexual or could be interpreted as sexual. What is the meaning of the term code of ethics? Operating principles and behavioral guidelines that members of a profession are expected to uphold, having requisite or sufficient skill, knowledge, ability, or qualities. A code of conduct that provides guidelines to those who post content on the internet as either part of a business or as a private individual. A principle that practitioners always act in the best interest of the client.
A.
That's right. Operating principles and behavioral guidelines that members of a profession are expected to uphold. Refraining from the use of any mind-altering substance before or during a massage is considered to be conduct under which code of ethics? Client relationships, appropriate techniques, scope of practice, or professionalism?
Professional?
I would say so. Yeah, professionalism. To prevent infectious and communicable diseases, the simplest, most effective way to minimize risk is hand washing. The CDC has 4 steps for proper hand washing. What is the second step? So the first step is get your hands wet.
Apply soap.
Apply soap to hands.
Apply soap, yes. And always read all the options. Rinse hands using warm water, rub hands together for 20 seconds, apply soap, dry hands with a paper towel, apply soap. Let's look at the order. Oh no, it's rub hands together for 20 seconds. Okay, good. So we have to get this really clear. So the first one is apply soap. I misled you. Don't laugh at the old man. The first one is
I would never apply soap first.
Yeah, I know, me either. The first one is apply soap to the hands. Number 2 is rub hands together for at least 20 seconds to work up a lather. Number 3 is rinse hands using warm water. Number 4 is dry hands with a paper towel. Yeah, so it's apply soap, rub hands together, rinse hands, dry hands.
Okay.
Yeah, all right. I agree. What is the meaning of the term learning styles? A labeling of signs and symptoms by a licensed medical professional, the identification of underlying cause, etiology, pathology, or nature of a set of signs and or symptoms, a person's preferred method to take in information. 3 most common are visual, auditory, and kinesthetic. A systematic method. Yeah, that one. What is the meaning of the term power differential? The role difference between a practitioner and a client in which the client is vulnerable and the practitioner has more power by virtue of training and experience. Sound good?
Yes.
What is the proper stance for giving a massage? Feet parallel to the table with weight on back foot. Body properly aligned with knees bent, shifting body weight with the flow of strokes.
Yeah.
Feet parallel to the table. Okay. Yeah. While acting in the massage or bodywork capacity, I will not tolerate any sexual advances from my client. This is in accordance with which code of ethic? Which code of ethic? The scope of practice, appropriate techniques, advertising claims, or client relationships?
Scope of practice?
Scope of practice is what your state says you're qualified to do, what you can and cannot do. For example, massage compared to diagnosing a disease.
So client relationship?
Client relationship. Yeah, client relationship. A lot of questions like that are really just process of elimination. What is required of a licensed massage therapist after the license is issued? Renew the state license and required insurance coverage every year. Obtain continuing education hours, no requirements, or both A and B.
A and B.
A and B.
Yeah, A and B. Continuing education hours and renew the license and required insurance every year. Just a second, please. What does subluxation mean? It basically means joint misalignment or bone misalignment. So spinal subluxation are vertebrae or ribs that are misaligned. The use of radiography, that's x-rays, to detect spinal subluxations and misalignment is within which scope of practice? Pediatric medicine, chiropractic, athletic training, or psychology?
Chiropractic.
Chiropractic, that's right. A summary or outline of standards to which the massage therapist agrees to conduct their massage practices with a declaration of acceptable, ethical, and general principles of professional behavior is the standards of practice, code of policies, code of ethics, or standard of regulations.
Code of ethics.
Code of ethics, yes, very good. Let's see, just look at the definitions for the rest of these. Do they have them? No. No, they don't. They don't have them there. I think we had them early on. Okay, I guess we're not gonna go through all of them. Yeah. Okay. So standards of practice was defined earlier as, I always like to get the exact definitions. Standards of practice are statements that describe the underlying principle of a given field, the expectation of professional conduct, and the quality of care provided to clients, the standards of practice. And then the code of policies, you could just call that the policies. Standard of regulations, that would be like what the state says you have to live up to, right? That could be things like qualifications to get certified or licensed, and to get recertified or relicensed, renewed every year. Okay, great. So we got to do more sections like this each class.